Okay, try again. All right, good morning, Dr. Felicity Keogh with Fertile in St. Louis. I am talking to you guys about a topic that I find very exciting. It's one of my passions to talk about, and it is prenatal chiropractic care safe? And if you are a patient of ours or you are familiar with prenatal chiropractic care and you're receiving that right now, you obviously know that the answer to that is yes. But there's a lot of misconception about what it is and what we're doing and whether or not it is safe. So I actually, when I was in school many years ago, I had a realization early on that I wanted to treat the demographic of prenatal women, prenatal care, and also children, because I realized that that is such an important time in a woman's life, because so often we just expect that time to be kind of blah, and we expect the pain and we expect the discomfort. And really, that should be one of the most memorable times in a woman's life, and she should be feeling as good as possible. She should remember that time as being a wonderful time and not a miserable, painful time. So that was when, back in 2004, is when I realized that I wanted to help this demographic of people when I became a practicing chiropractor many years later. So it was back in 2004 that I started training with the ICPA, which is the International Chiropractic Pediatric Association, and that has allowed myself and my other practitioners in my practice to understand and fully be confident in treating moms that are pregnant as well as small children. Now, if you know us, you guys know that we treat every person. We treat a lot of men. We treat a lot of sports injuries, extremities. We treat everything that a chiropractic office would treat, a lot of headaches and back pain, and we get really good results with those. But our biggest passion is helping moms that are pregnant, moms that are thinking about becoming pregnant, or maybe they just had their baby, and children. So that is where our passion lies, and that's what I'm talking to you guys about today. I also want to mention that there is I think all chiropractors are trained to some degree in school, a small amount. There was a small amount of training that I had in school that helped me understand how to treat these women that are expecting. But I will mention that the chiropractors who go on after school and do the certifications and the trainings, in particular the ICPA, International Chiropractic Pediatric Association, among other trainings, those are the chiropractors that really have a good understanding of how the pregnant woman's body works biomechanically and physiologically, all the things that are happening, and they really get the most amazing changes when it comes to conditions that a pregnant mom is coming in with, or a child. So before we get into all of that part of it, I just want to take a minute to briefly explain what chiropractic is. A lot of people don't know what chiropractic is. So I'm going to just explain it in just a few sentences and keep it really, really basic and really simple. Chiropractic is natural health care. That's really what it is. And we aren't necessarily treating any one condition, but what we're doing is we're removing interference in the nervous system that impacts how our body functions. So, for example, chiropractors call misalignments in the spine, we all call it something different. So our practice calls it a subluxation. There's other chiropractors that call it a fixation or a restriction or a misalignment. Everybody calls it something different. But when the spine is imbalanced and misaligned, that's going to put interference into the nerve roots. And those nerve roots go out and impact all the organs, tissues, and cells of your body. So what we're doing in chiropractic is we're removing that interference from the nervous system so your brain can talk to your body again, because the brain controls everything. The brain is the master control center, and without the brain, nothing in our body would be working. So that's really all that chiropractic does, is it removes that interference. I have hair on my face. That it removes the interference in the spine that is hanging up the nerves, that causes irritation to nerves that go to certain endpoints in the body, be it an organ, cell, or tissue. And that's it. Very, very, very simple. And with that, we see a lot of amazing changes happening in our practice, and all chiropractors do. So basically, what causes those subluxations is the next question that most people have, like, how do I get those subluxations? Well, our cranium, our spine, our pelvis is made up of movable joints. Believe it or not, all of those joints move to a certain degree. And because of that, we are susceptible to those misalignments. We are susceptible to our joints being misaligned. And that is just a benefit of being able to move like we do. And because of that, we get misaligned. Now, misalignments can happen from physical stressors, be it like carrying a child on your hip for years, just kind of carrying kids around can be very, very challenging for your structural system, because typically we pick a hip and we always default to that same hip. Nursing a baby, like constantly looking down, sitting at a desk and constantly looking down. Driving, the impact from driving, car accidents, all of that, those are physical stressors. But we also have to remember there is mental stressors, like getting a new job, being fired from a job, a funeral, a divorce, getting married. All of those things are mental stressors that, believe it or not, can impact our nervous system. And the other stressor is chemical stressor. So a chemical stressor is the ginormous drink from Starbucks that you had this morning, or any prescription medications, junk food, anything basically like that can impact our body on a chemical level and cause chemical stressor. It's a cause interference in the nervous system because of that chemical stressor. So there's mental stress, there's chemical stress, and there is physical stress that all impacts our nervous system and how our body functions. Oh, jumped ahead on my notes. So the next step that I have to talk about is Webster technique. And if you have heard about Webster technique, you've probably done some research on what types of chiropractors are best to see during pregnancy. I highly recommend, if you are expecting, maybe you're thinking about becoming pregnant, maybe you're far, far along in your pregnancy, it doesn't matter, wherever you are, I highly recommend seeking out a Webster certified chiropractor. Because, as I talked about earlier, those are the chiropractors who understand how a woman's body functions and biomechanically functions and how she's physiologically changing, and you're going to get amazing results with a Webster certified chiropractor. Not that you wouldn't get amazing results with somebody who is not a chiropractor, who is not certified, but something that I always recommend to women is seek out somebody who's certified in Webster. Maybe you have a chiropractor that you've seen for 20 years and you're used to them and that's what's comfortable to you. You just have to ask yourself, if you don't feel like you're getting what you need, then seek out a Webster certified chiropractor for the remainder of your pregnancy. And then as soon as you're done, then you can go back to your regular chiropractor, right? There's no hurt feelings. That's something that I really encourage women to do if you're just feeling like you need more out of your chiropractic care. And there's a lot, well, I wouldn't say a lot, but there's several Webster certified chiropractors in this area alone. And I will leave a link in the comments to a directory where you can go and search and put in your zip code, and you can pull up chiropractors in your area that are trained particularly in this technique. So if you're watching this from a different state, that might be very beneficial for you. So I will post that after I'm done today. So what is the Webster technique? The Webster technique is basically an assessment and an adjustment of the pelvis and the soft tissue that surrounds the pelvis, in particularly the sacrum. And we're looking at that because the woman's body has those changes that take place, and it helps us to understand what's going on in the woman's body and then also treat her. So what are some of the reasons that a pregnant mom might seek out specifically a prenatal chiropractor? Well, we talked about the mental and the chemical and the physical stressors. So let's just look at some of the physical stressors that take place in a woman's body. One being just the hormonal changes. She has relaxin, she has increased progesterone, she has these hormones that are increasing, and they're causing her body, her joints, to basically prepare for birth, prepare for opening. So everything is a lot more unstable, and things shift a lot more, which makes you more susceptible to those subluxations that we were talking about earlier. Pelvic imbalance. The number one reason I think for these major pelvic imbalances that we see, myself and my other practitioners in my practice, in a pregnant woman, is because we sit so much. We sit, as a society, we sit so much more than we should. We are made to move. Our bodies are made to be moving and not sitting all day. If you think about it, we wake up in the morning, we drive to work. If you have a desk job, you sit at your desk all day, and then you drive home, and then you eat dinner, and you are tired. Especially if you're pregnant, you want to sit down. So thinking about how much somebody might sit leading up to pregnancy and then during their pregnancy, it makes a lot of sense why we see so many way misaligned pelvises, because as a society we're not doing what we need to do to take the movement. So little things like, I mean, unfortunately, a lot of people have a desk job. You can't do much about that, but maybe taking the steps to look at getting a different chair. You know, those chairs that have exercise balls in them, that's way better than sitting on just a regular chair. Also, maybe a stand-up desk. We write letters all the time for our patients to help them get that stand-up desk because we know how much more beneficial that's going to be for them. So some of those things are really important when you're looking at the movement aspect of it and the pelvic misalignment. Your abdomen's growing, so everything is growing forward, and that's creating shift in the pelvis as well. Increased lumbar lordosis. If you don't know what that means, that's basically where the lower back has an increased curve in it. Some people call it their sway back, where the lumbar curve is just increased so much. That's going to cause a lot of pressure on those nerves in the low back, can cause a lot of lower back pain, hip pain, sciatic pain. And then the soft tissue. We have to think about the soft tissue that surrounds the baby in the front. If a mother's pelvis is imbalanced, that's going to impact the soft tissue in the front. So if you've ever had round ligament pain, it's no joke. That stuff is painful. So round ligament pain, or any ligament pain or soft tissue pain, can sometimes feel like a sharp stabbing pain in your lower abdomen on one side or the other. And a lot of times it's coming from those imbalances that the mom has in her pelvis, in her low back. Also, it can affect how the baby positions themselves. So one thing that we always ask in our histories, when we see a newly pregnant mom, or maybe she's postpartum and maybe her baby's 5, we have to ask these questions. When you were pregnant, did you have any reoccurring residual type pain in any particular place in your abdomen? And sometimes they'll say things like, yeah, I had pain in my upper right ribs, and it was constantly there. I felt like her head was just stuck under there all the time. That's important to know as a practitioner, because then you can kind of link back to what was going on in mom's body and then how that may have impacted the baby as well. But those are all signs of intrauterine constraint that occurs because of imbalances in the mother's body. Also, if you have those restrictions in your abdomen and your soft tissue that surrounds the baby in the pelvis, that can impact how your baby can get into the right position for birth. So that, third trimester, when the baby is shifting into those positions that it needs to get into so it can prepare for birth, ideally the head down position, if you have restriction or intrauterine constraint, that's going to impact how easily the baby can do that. So that's one thing that we're doing as well. We are not moving the baby, we're not touching the baby, we're not doing anything like that. We are simply removing interference and removing those restrictions, so then when mom stands up and she's now in gravity, that baby can start to do what they need to do, which is go in the head down position. Also, movement. Movement is so important for proper development, proper growth, inhibition of reflexes. If that baby is tied up over here on the right side and they can't get out of that spot, that's going to impact their growth and their development and their inhibition of reflexes. So important to make sure that the mom is free of interference and has a balanced pelvis. Also, pubic joint pain or pubic symphysis dysfunction. If you've had that before, you know firsthand that is awful pain. It feels like lightning bolts between your legs. It's terrible. And that is another condition that we see a lot in our practice. We also can help mom by adjusting her lifestyle so she's not doing the things that might be creating that. Adjustments are amazing at helping SPD, symphysis pubic dysfunction, and we can also give some home exercises that help that from reoccurring. Couple more, we have thoracic pain and thoracic and rib pain. When you are pregnant, your breasts grow, and that can impact your middle back between your shoulder blades. Also, the ribs change. Your ribs move up and out when you're pregnant, so that can cause a lot of rib issues and rib subluxations. So pregnancy and then that postpartum period, we see a lot of moms coming in with those types of issues as well. And then lastly, neck pain and headaches. There's more, but these are the main ones that moms come into our practice for. So when you're growing a baby and your abdomen is growing and protruding outward, your center of gravity changes. So your head follows your center of gravity. So that creates this thing called forward head posture, which kind of looks like this. Not really doing a great job, but it's very attractive, as you can see. But that's where the head is going forward, and that not only looks like bad posture, and that's the number one reason people say they have bad posture is because their head goes forward, but also it creates neck pain and headaches. And so chiropractic is amazing at rebalancing mom so she can recenter her center of gravity and bring that head posture back. So those are some of the major reasons we have moms coming into our practice, but we support mom wherever she is. We have a lot of moms in our community that come in before they even are pregnant, which is amazing because that's good education, where these moms are taking the time to educate themselves, but they want basically their body in fine-tuned position. They want their structural system to be really great. They're getting their blood work, they're getting functional testing, so they really can identify any imbalances that are happening before they conceive their baby, so they can get that stuff fixed and out of the way, and they have a better chance at conceiving their child. So those are great people to work with. We love working with those people. We also have people come in when they're pregnant. A lot of people come in when they're pregnant. Come in early on. We have some people that come in very late, 38, 39, 40 weeks. Maybe their baby's in the wrong position, or maybe they're dying of sciatic pain. It doesn't matter where you are when you come in. That is so important for everybody to know. Maybe you're coming in at 40 weeks and you didn't know that chiropractic was an option. So you can't be hard on yourself for that. You have to kind of give yourself some grace with that. But if you're educating and you understand the benefits of chiropractic care for pregnant moms, coming in as early as you can is going to be more helpful, because the more time we have to work with you and your body, the better outcomes for your pregnancy, your labor, delivery, and beyond. So that's always very important. And also in the 4th trimester, we see a lot of moms come in after they have babies and they didn't know, they weren't aware. So they're coming in now because they're still dealing with those residual effects of whatever they were dealing with during pregnancy, be it low back pain, hip pain, headaches, whatever. So we support moms wherever she's at, wherever she's at. And we always ask, what are your goals? I think it's very important that all practitioners ask, what are your goals for your pregnancy? What do you want? Because then we can help them. We can help them and support them along the lines of what they want. Early on in my practice, I wanted everyone to have a natural birth, and I realized that not everyone wants that. There's some moms that don't want that. They want all the meds, and that's totally okay. But we just want to know where you're at, and we ask what you want, so then we can support you in that. And whether you want all the meds or you want a completely natural birth at home with your husband and your midwife, we just want to make sure that you're comfortable, you're not dealing with pain and discomfort, and that your baby is in a good position and you're balanced, because the outcome is going to be better. Chiropractic care has been shown to lead to a more straightforward, easier, uncomplicated, low intervention birth. So that's so important to us. So wherever you're at, that's what we want to support you on. And that's the main thing that's very, very important. I will say one thing, we also want to make sure we educate our moms too, because that's key. Education is key, and I think if we know more, then we're going to make better decisions. So one thing I will say about the epidural is, if you're going to get an epidural, totally fine, get one. But understand that you have to kind of consider your baby as well when you are, doing those types of interventions, because those things can impact your baby. So one thing that you can do that would really make a big difference in your baby's health is labor as long as you can. Try to go into labor naturally, if you can. Sometimes that's not possible. And then when you're laboring, what's happening is you're building up these endorphins, which are nature's greatest pain relief, right? That's the whole point of labor is, labor is hard. It's hard work and it's painful, but your body is building up these endorphins, and that is helping you cope with the pain. And not only are you building them up in your body, but your baby is building them up in their body as well. So if you get an epidural right out of the gate and you don't want to feel any pain, you have to think about your baby, because the baby is still feeling the crushing blows of the epidural. So if you give your body some time, 5 centimeters, before you get that epidural, you're going to have a baby that's had some opportunity to build up their own endorphins, and they're going to feel less of the crushing blows of the contractions. So that's really important, and I just like to educate the moms on that so they understand, and then from there they can make the best decision for themselves and their family. All right, so basically our goal is your goal. That's the most important thing that I want to stress, and really we just want to make sure that you're comfortable, you're balanced, you're well aligned, and they're gonna go easier because of that. And then of course I want to end on this because we're almost done. We always educate our moms and dads on the importance of pediatric chiropractic care, because that's a little bit of there's a big misconception on that sometimes. If we don't know what a chiropractor is going to do to your baby, there can be an element of fear. So I like to clear that up and make sure I educate our parents on that and educate you guys today. But once again, making sure that you seek out a chiropractor who's trained in the very gentle adjustments that can be applied to a delicate infant's spine and the biomechanics that they have, that's very, very important. My son was adjusted the next day after he was born by myself. I have moms that come in literally on their way home from birthing their baby. They pop into my office and they get adjusted, which I think is amazing. I couldn't even think straight after I had him, so I completely forgot to adjust my son until the next day. So it doesn't matter when you adjust your baby, earlier on the better, because birth, as you know, if you've had a baby, is hard. It's very difficult. And it doesn't matter if you have the most natural birth in the world or the most traumatic birth in the world, there's an element of strain that occurs to the baby's head and to the neck during the birth process. So we always, always recommend on your postnatal visit, when you come back in and you get your postnatal exam, bring your baby so we can check your baby. And what we're doing in that process is we're just gently touching the baby's spine, cranium, spine, and pelvis, so we can understand what happened during birth and what misalignments are there in them. And the pressure that we're using is about the pressure that we would use to test an avocado or a tomato for ripeness. Or even better is if you put your finger on your eyeball and you just gently press, the amount of pressure that you would comfortably put on your eyeball is about the pressure that we would use to check and then use that to correct those misalignments in the baby. And we're simply waiting for those restrictions, those misalignments to balance out. There's no noise, there's no popping, there's no cracking, twisting, nothing like that. That is not how you adjust a baby. Babies are all membrane anyway, so you wouldn't even want to get a cavitation, which is the pop sound when you're adjusting a baby. So very, very, very important that you understand that. It looks like we're just going down the baby's head and spine and pelvis, and we're just feeling. That's what it looks like. So it's very, very gentle. I just want moms and dads to understand that, because there's an element of fear if you don't know or you're not educated on what we're doing. So that is everything that I have for you today. I hope that clears up any misconceptions that might be out there. If you have questions, please, please, please comment or send us a message. If I'm just curious, if this is a topic that interests you, can you just drop me your favorite emoji so I kind of know, how important this topic is to you guys? That would be really, really great. And of course, just ask any questions that you might have. And also, if you aren't aware, Dr. Emily and I, as well as Dr. Michael Shainwolder, we have changed the format of our workshop. We're now making it more accessible, more affordable for all of you by doing an online workshop. So same date, same time, but now you can listen in to the webinar from the comfort of your home, in your pajamas, and it's just a lot easier and a lot more accessible and more affordable. So we really hope that all of you are there and you ask questions. There'll be a live Q&A where you can ask Dr. Emily, myself, and Dr. Mike any question you want at the end of that webinar. So hopefully you guys are there. Again, if you have any questions, let us know, and I hope you guys have a great day. Talk to you soon.